Hello, my name is Christina Hicks, and I am the Deputy Director of Program Development at the California Primary Care Association. One of my primary responsibilities is to coordinate our summer intern program, and for the second year in a row, CPCA is partnering with the Health Career Connection intern program to promote the placement of undergraduate students in community health centers across California. We have co-produced this webcast to talk a little bit about the program and to share with you firsthand experiences from an HCC intern, a preceptor, as well as a health center CEO. Investing in the healthcare workforce is very important to CPCA, so much so that related activities are outlined in our strategic plan. And while this webcast is meant to encourage health centers to participate in the HCC intern program, I'm proud to say that CPCA is also an active employer in the program and has been for several years. The picture you're seeing now is our most recent intern cohort with some of their preceptors. Before I turn it over to Jeff Oxendine from Health Career Connection, I want to say how excited we are about our continued partnership with HCC. We encourage everyone listening to consider bringing on a student or two or more into your health centers this summer as a way to grow and support a diverse healthcare workforce pipeline in California. Our goal this year is to place at least 85 interns in health centers across the state as a way to expose more students to opportunities working in healthcare, and more specifically in community-based healthcare settings like yours. So without further ado, I'd like to introduce Jeff Oxendine, founder and CEO of Health Career Connection. Jeff, thank you so much for being with us today.
Thank you for having me.
So
and I'm very excited about the, go ahead, sorry.
Oh, no, that's all right. We're excited too, and I'm hoping you can tell us a little bit more about Health Career Connection and how long it's been around.
Well, Health Career Connection is a national nonprofit that inspires and empowers the next generation of diverse health leaders and professionals, particularly those that want to serve underserved communities and be leaders in safety net settings. Health Career Connection has been around since 1990. It was founded in Northern California, and since that time we have worked with college students that are from underrepresented and or low-income background to get exposure, experience, mentorship, and networking to choose and successfully pursue the health career that best suits them, and to get jobs and to go on to graduate school and to become health leaders. And we have a particular priority focus through our partnership with CPCA on producing health leaders and professionals for community health centers.
That's great. That's a long track record of training and placing students in healthcare or health-related organizations. That's great. How many interns have you placed over the years?
So Health Career Connection has over 3,000 alumni, and many of them have gone into administrative or policy roles in the health field, and many have gone into clinical roles such as physicians, nurse practitioners, physician assistants, pharmacists, and other needed professionals. And many of them got their initial start through our internship in community health centers. Very exciting that some of them are actually people whose families receive care from community health centers, and our real focus is having students from local communities get the opportunities to work in health centers and other health provider organizations within their own communities so that they can see that it's possible for them to give back to their community in that way and to meet our future health workforce needs. And so we place students all throughout in health centers all throughout California. HCC is in Northern California, Central California, Southern California, the Coachella Valley, the San Diego area, and we also place students in our other in health centers in our other regions around the country.
That's great, and we've got now up on the screen a partial list of even some of the health centers and regional associations we've worked with too, so it's great to see that wide reach. What kind of outcomes have you seen from the program, and why is it so important to have?
The program is critically important because, as we all know, our population is becoming increasingly diverse, which is a wonderful thing for our state. And at the same time, our emerging majority populations are significantly underrepresented in the health professions and in health leadership positions. So what Health Career Connection has done is help contribute to moving the needle on the number of health leaders and professionals from Latino, African American, Native American, and different Asian backgrounds who have the language and the cultural skills and the lived experience to help them be more effective at treating and promoting the health of our increasingly diverse populations. And the outcomes that we've seen is that starting during the internship experience, 96% of our students say that this internship experience has a profound impact on their health career and their life direction. It's really life-changing for them, and it puts them in a different career and life trajectory, and they know what they want to do and how to pursue their passion. The other outcomes we look at are that over 70% of the students get offered a job or to extend their internship through being part of Health Career Connection. And so that's a way that the students benefit and the employers benefit. 96% of the employers say that hosting an HCC intern is a good return on investment because they have the chance to hire people, but also the students do great work on priority projects, and they have the experience of having an amazing young person in their midst. And then longer term, over 80% of our Health Career Connection students go into undergraduate school in the health professions. And I mentioned they either go into administrative, policy, community, or clinical paths. Over 70% actually go into a primary care related field. And I believe over 65% are focused on wanting to serve underserved populations in the future. We have Health Career Connection interns who are CEOs of hospitals, who are executive directors in community health centers, who are medical directors of health centers, who are professors at universities, who are in all walks of the health field and making a difference in the community and with the populations that we value so much.
Well, certainly a wide reach, very influential, and I can say directly on CPCA's behalf, we've benefited as well. As a matter of fact, we currently have 2 employees who were former HCC interns, so it's a wonderful program. Your focus is to support and develop, of course, underrepresented or disadvantaged students within the health profession settings, but you also support the employer side in terms of helping recruit and with the selection process. Can you tell us a little bit about how that works?
One of the real advantages for health centers is that HCC is a turnkey program that makes it really easy for health centers to choose and to onboard and to offer an experience for the exact type of candidate that will be a great fit for the work that they need to get done and for their culture and for their community. Health Career Connection has 27 years of experience in identifying promising candidates who meet the priority needs of our health center partners. We identify them, we screen them, we send you a small subset of students that fit the characteristics and the priorities that you outline so that you're not sorting through a huge list of resumes. You're getting targeted candidates who fit the parameters that you identify. We then help you find a good match. The strength of HCC is matching dynamic students with the organizations that will be a best fit for them. And then we help you to supervise them in the summer to make sure that you and the intern are having a real positive experience. We also help employers with recruitment of our alumni. Our over 3,000 alumni, as I mentioned, are in all walks of health professions and are the kind of candidates that health centers are interested in. And so we have a way to promote permanent jobs to our alumni network and help you get great fit candidates to be leaders and professionals in your organization.
That's wonderful. Well, thank you so much for that information, Jeff, and we'll have this information again at the end of our webcast. But for now, any just lasting or parting advice for health centers kind of wishing to work with interns? What do you think makes for a great intern program?
I think what makes for a great intern program is an organization that, as Christina started out this conversation, that is committed to workforce development and to building a pipeline of diverse health leaders and professionals. And as part of that, really creates meaningful experience for the students so that they can be inspired to work in a health center setting. And that means we're having them work on meaningful projects, having them have access to mentors, role models, being able to sit in on meetings, be able to get exposed to the community and work with the community and with all different types of health professionals, and have them walk away with an accomplishment on an important project, one or more important projects that the student can be proud of and can talk about as they go forward and can build practical skills with, and also that your organization can point to say, wow, this was a value to our organization in addition to getting the experience of supporting the student. And I think it's the match that I talked about earlier of having Health Career Connection work with the health center to identify what you're looking for and then find the best fit student to be able to do that. And usually in that case, and the reason I've done Health Career Connection for so many years is because it really is a win-win. It's a win for the student who figures out what they want to do, gets a job, and gets on a new trajectory. It's a win for the health center that gets their priority projects done and hopefully gets to hire a great person or contribute to the pipeline. And it's a win for our communities who have more people from our communities become the future health leaders, diverse health leaders and professionals that they need to provide quality, accessible services. So it's a win for all.
Well, I appreciate your time today, Jeff, in talking about the Health Career Connection program. And we're going to get a chance to hear directly from some folks who benefited and participated. So thank you for your time today, Jeff, and really appreciate all of the great information.
And thank you to you and CPCA for this exciting partnership. Thank you very much.
Okay, well now I'd like to talk with someone who has been an HCC intern and experienced firsthand how the HCC program can support students' professional aspirations. I'm talking now with Josue Fernandez, currently the Compliance and Business Services Manager for Omni Family Health in the Central Valley, and once upon a time was actually an HCC intern with Omni. Welcome, Josue.
Hi, thank you. Yes, first of all, thank you so much to CPCA and Health Career Connection for this opportunity to be a Health Career Connection advocate. Also for our CEO, Francisco Castillon, with Omni Family Health for supporting me in this. Thank you so much.
Great, welcome. Well, so Josue, let's start off by just talking about what initially interested you in the health professions.
So initially, I first started growing a passion for becoming, what I envisioned back then was a little bit differently, but I wanted to be a change agent in the low-income and impoverished and uninsured populations and the care that they received. And in particular with community health centers, because I was a user as a child. My parents used to take me, for a common cold or a fever, things like that. And early on, I saw with my own eyes the need to improve this safety net, if you will, in providing quality care. So I always felt I had a path to helping these individuals, which I related to and I identified with as well.
That's great. So it really sounds like that was kind of the impetus for you deciding to want to becoming an HCC intern.
Yes, absolutely, and it was a kind of a funny story. I went to CSU Long Beach for my bachelor's degree, and I initially wanted to be a dentist of all things, and that's
Oh,
what I had thought I would explore in the health professional area and how I would help again this population. But as it were, I actually shadowed a dentist for a summer and actually found out that's not what I wanted to do. And so I had to take a different path, and I'm very happy that I did. I went into healthcare administration as a major. Um,
uh-huh.
and so within that major, I had an opportunity to receive an email from one of our secretaries in our department to sign up for this opportunity with Health Career Connection. And it happened to be the last day that the deadline was to submit for the application, and I happened to see it at 10 p.m. at night, and it was due at 12 p.m. that night. So I had nothing else to do that night, and luckily I made the decision to submit it, and here I am. So I actually did my internship with Alumni Family Health, and I did my summer internship with them, and I had one more year of school left, and luckily I was able to maintain communication with the executives here, and I was able to earn a position right after I finished school.
That's great. So prior to taking on that full-time intern position, in your internship, what do you think was your biggest takeaway working at a community health center?
Well, I think the biggest takeaway was it kind of solidified what I wanted to do in my career. I had the opportunity to also do an internship at a local hospital there in Long Beach as part of my HCA program, and I was almost tempted to stay there in Long Beach because, of course, it's the beach, so it's hard to get away from that. But it really brought me back down to my roots, and I did the internship here in Bakersfield, California, and again, just reemphasized my drive and my passion to come back and serve this population that, again, I had seen that there was such a need to improve the care that was being provided, and be an influence in that sense.
That's great. So just kind of to end our conversation, Josue, what lessons did you take away kind of from your experiences as a Health Career Connection intern?
I really think that the biggest thing that I can take away from my HCC experience is don't be afraid to put yourself in situations of anxiety. You know, as an intern, you're kind of hesitant and apprehensive, and don't want to step on anybody's shoe, kind of a thing. But definitely ask questions and seek those appointments with the executive level individuals, because you don't always know what you want to do in your career, and the only way you're going to figure that out is if you ask the questions and put yourself out there, and see what it is that you want to do, whether it's perhaps in finance, whether it's in HR, or whether you're looking to be a health professional as a medical provider, and perhaps you shadow a doctor for a day and you decide that's not what you want to do. Like myself, I wanted to be a dentist, and I found out that's not what I wanted to do. So so definitely relish the experience of being in the setting that you might be for the rest of your life, and find out if that's what you really want to do.
Well, thank you so much, Josue, for your time today. I'm sure Omni appreciates you coming on board as an intern and an employee, and all of your great contributions, and we wish you continued success at Omni Family Health. So thank you so much today.
No, thank you. Appreciate it.
So our next speaker is the Deputy Director of Lifelong Medical Care, a community health center serving communities in the East Bay of the San Francisco area. Lucinda is also a longtime Health Center Connections preceptor and can give us great insight into how to best train and support our future health professions workforce. Welcome, Lucinda, and thank you so much for joining us today.
Thank you for having me.
So how long have you been with Lifelong, and how long have you been precepting?
So as Deputy Director, I'm a member of our senior leadership team, and I've been with Lifelong now over 20 years. And I started with the HCC program, I think when they first started in California, so I think that probably was around 2005.
Mm-hmm. Wow, that's great. And what made you kind of agree or want to take on the opportunity of precepting and working with the HCC program?
So since I've been with the organization, I've always participated in any of our volunteer programs. I actually helped start our volunteer program. And so it's been very important for me to make sure that we have a robust volunteer and internship program because I remember I was introduced to healthcare because someone stepped up and mentored me starting as far back as high school. So I think it's a great way for me to give back to others who are coming along and considering healthcare as a career.
That's great. And yes, that mentorship and guidance is so important. What kind of projects have HCC interns typically worked on in the past with Lifelong?
So whatever I've been working on, our HCC interns have had the opportunity to work on as well. So that would include policy and legislation activities, administering patient satisfaction surveys and focus groups, staffing our diversity and inclusion committee, special projects in developing parenting programs when we were putting those together, our wellness activities, projects with Healthy Richmond and Building a Healthier East Oakland, which are sponsored by TCE. So a variety of projects over the years, and even assisting with the National Health Center Week activities.
Wow, so really a wide variety of work. That's great. I know, because I've also precepted, that volunteering as a preceptor does take time and commitment, and we know many folks are nervous to even consider taking on a teaching role given their regular kind of day-to-day responsibilities. How do you balance your regular day-to-day responsibilities with your precepting work?
So, I must say you have to have the right folks. Choosing to mentor is very important because you want to have a good experience for both the mentor and mentee. So, I balance my time beautifully because, as I said, I've chosen projects that I've been working on or that I need to work on. So it's very helpful to me in doing my work to have some eager and talented students helping me to work on those projects. So it accomplishes two things at once. I'm teaching and mentoring someone at the same time while getting my work done, and in some cases, faster and even better.
That's great. And I know another really important key is also just having really supportive leadership. And of course, you are on the leadership team. But can you talk a little bit about ways that lifelong leadership generally has kind of supported your ability to precept and the organization's ability to take on interns?
Correct. So as a part of the leadership team, I have the unique opportunity to discuss with our team the importance of having interns and having staff be able to mentor. So, I lead by example, of course, and I talk about the importance of having the HCC program because it's helpful, again, in having our supervisors, smartly do their work, and it helps also in us developing our workforce pipeline. I think it's very important for our organization to make this opportunity available so that we encourage our young folks or individuals interested in healthcare to really, get a great experience so that they are looking at choosing healthcare as a field, and particularly community health centers.
Sure. So what would be one piece of advice that you would impart on a preceptor considering this opportunity, whether they are new or seasoned?
Yeah, like I said, it's very important, I think, for us as community health centers to use the HCC program as a workforce pipeline. It's an opportunity for us to engage individuals interested in healthcare and giving them a great experience to consider coming back to work with us. I started in this program over 10 years ago, and I still keep in touch with my interns. Whenever there's an opportunity for a new job or a new project, it's wonderful to be able to reach out to those individuals to fill those positions.
That's great. So is it safe to assume you'll be taking on HCC interns again this summer?
It's very safe to say that we've been doing it for the past 12 years, and I'm not changing this year.
Well, fantastic. Well, thank you again so much for your time today. We wish you the best with your summer 2018 intern program. And again, thank you so much for your time today.
Thank you.
All right, so our final speaker on today's webcast is Luisa Buada, the CEO of Ravenswood Family Health Center. Luisa, thank you so much for participating in this webcast today.
I'm happy to do this.
How long have you been specifically recruiting and utilizing HCC interns? Has that been the full 12 years?
Yes, since 2006, every summer we've had anywhere from 2 to 5 HCC interns who've worked with us for at least 6 to 10 weeks, depending on their school, and some of them have stayed on after finishing the program, either as employees or just because they had more time beyond the HCC internship itself.
That's great. And what kinds of work streams or projects does Ravenswood typically have that both allow you to increase your capacity as a health center, but also work as great learning opportunities for interns?
So interns, we usually, because it's a summer job, although they're full-time, we give them discrete projects that they can complete within the summer. And so they're often projects that we'd like to do, but often the existing staff are overwhelmed with day-to-day operations and don't get to. So some of them are like research projects around data, writing certain kinds of reports. But the big thing that they do is when we have the National Community Health Center Week, all the HCC interns really provide a lot of the hands-on for those events and are very helpful in recruiting people from the community, doing publicity, and preparing for those events for us.
Great. And can you share a particular, maybe great student success story from your years working with health profession students?
Yeah, so actually in 2006, one of our first HCC interns came on board, and at the time we didn't have EHR, and we were trying to figure out why in the summer pediatric patients there was such a high no-show rate. So she did an analysis and called families, about 100 families. She was bilingual. She was finishing her bachelor's degree in health services administration from San Jose State, and so she did a little analysis. It was very informative and did a great presentation to the board. And so after she left to finish her last semester of school, we said, when you're through, please apply for a job. And so we did ultimately hire her to assist us with our developing our mammogram program. So she developed a mobile mammogram program for us, which went on for about 3 or 4 years before we had another opportunity to provide mammograms locally at Palo Alto Medical Foundation, which she also developed that program and ran it. She's now our manager for Women's Health Services. So she came on board in January 2007 and has now been with us. It'll be 11 years. But moved up into a management position. She since has gone back to school and got her MPH as well.
Wow, that is a really great story. I mean, to bring on a student to provide a project that really probably bolstered her own confidence, increased capacity for the health center, and she's still with you. That's amazing. How has having health center connection interns been beneficial for your health center? I mean, that was a great example, but you've kept at it for now going into your 12th year. What are the benefits that you've been seeing?
Well, I can say this because I'm old, but bringing on students who are bright-eyed and bushy-tailed and full of enthusiasm and desire to learn it's really, I think it brings, it improves the positive ions and the attitude of everyone around to it. Sometimes, we can get a little jaded with day-to-day, and they're really, the rest of the staff get along with them really well. They appreciate so much. It's so great to be around folks who, for the first time, are seeing real healthcare delivery rather than just imagining it or having reading about it in school, and their feedback and perspective makes us appreciate the work that we're doing because, like I said, we sometimes get worn down by, lack of resources and the challenges that we face and, the difficulty in delivering care, and our patients have so many challenges as well that it can be discouraging especially when the economy is not doing well. And they come on board, and they're happy, they're helpful, they just want to, do a great job, and it makes everyone feel good to have them around and have someone that can help share the burden of our work.
Louisa, I can't thank you enough for your time today and for sharing your insights around the Health Career Connection intern program. So you'll be bringing on another intern in 2012. We wish you the best of luck. And again, thank you so much for your time today.
You're welcome. I'm really glad that I had a chance to do this. Thank you for your work.
So I want to once again thank all of our panel presentations today for this great webcast to learn about the Health Career Connection program. Help us reach our goal to place 85 interns in community health centers like yours across California. It is so important to the workforce diversity pipeline effort. If you're interested in becoming a host organization, applications are due February 15th of this year. There is contact information there on your screen with a phone number as well as a email address, and you can go to their website at www.healthcareers.org/apply to host. Thank you for listening today, and we look forward to hearing all of the great work that's coming out of intern programs across the state. Thank you.